But the theme of DRIF in Nigeria this year is digital inclusion as where all rights begin. So Paradigm Initiative has always prided itself with bringing into the room various stakeholders. And today, I think we have done this. So why is the media and journalists, why is it an important thing to talk about? They have the tools to reach large numbers of people and inform them on key issues ranging from policies to elections and so on and so forth. So when you're having conversations about digital rights and digital inclusion, lots of journalists have also not encountered this topic. We took the immediate opportunity to partner with the WIT Center for Journalism under the African-China Reporting Project, which Bongiwe will speak to better, where we integrated some journalists into our Digital Rights Academy, bombarded them with information on digital rights and inclusion. So this panel hopes to get them to speak to what it was that they reported on, what their challenges were, and their experiences in such a short amount of time.
Thank you so much, Khadija, for that warm introduction. And thank you everyone for having us. Molweni Dumelan, Sanibonani, Nda, and those are some of the few greetings from our official languages in South Africa. So I am Bongiwe Tutu, and I'm the acting project coordinator of the Africa-China Reporting Project. And I will be speaking on the impact of the project in its engagement within digital identity systems, data and technology in Africa. So the Africa-China Reporting Project is based at the WIT Center for Journalism, and that's at the University of the Witwatersrand, which is commonly known as WITS University. And the project has been operational since 2009 with the aim to improve the quality of reporting on African and Africa-China issues. And those are just some of the collaborations and partnerships that the project has engaged in within the workshops and training for journalists and cross-border investigations and media impacts. And then these are images from some of the workshops that we have hosted within African countries, including South Africa, Ethiopia, Cote d'Ivoire, and Kenya.
I want to recognize Bongiwe Tutu, the Acting Programs Director of African-China Reporting. With her financial support, is able to assist myself and many more journalists to write stories on digital rights, and of course to the entire Paradigm Initiative team. I wrote on the use and ownership of double or multiple permanent voters card and its threat to democracy, basically talking about the abuse of digital rights by Nigerian electorates. So knowing back in 2021 that the 2023 elections is fast approaching, I decided to write an investigative piece on the PVC. We do understand that I think sometime last year, INEC introduced the CVR, which is called the Continuous Voters Register. And it was a new initiative and the best thing from, or the newest best thing from INEC, trying to get people registered online first, so the physical INEC offices are not overly crowded.
I've been working with people with disabilities for a couple of months, or let me say years, and I think that was actually what informed the reason why I wanted to delve into the challenges of people with disabilities while registering for the national identity number. But the issue is that when I had discussions even prior to going to the field, the questions, the issues pertain to how they were able to get access to some of these buildings, particularly because we have a national act in Nigeria that actually caters for the specialty, the need to actually cater for the needs of people with disabilities when registered for this compulsory NIN. So when I got to the field, I found out that, okay, before that, as of today, NIMC actually got, the federal government actually got a grant from the World Bank to increase the number of people with NIN records. I think by 2024 or 2024, there should be about 140 million Nigerians on the NIMC record database. But the issue is that it gave a lot of targets as to number of women that should be there, as to number of children that should be in that particular target. But then I found out that the target for people with disabilities is not included in the data set that was made available. So I went out to investigate, and by December 2021, Nigeria has registered 71 million people on the NIMC database. As of now, we don't have a definite number of people with disabilities on that that have been captured by that particular database. So some of the things that I found out is that what are the challenges of people with disabilities when I go to the field? There's this 52-year-old woman in Ogun State, Bolaji, who has leprosy. As of today, she enrolled for NIN, and then for over 8 months, and even up to now, she hasn't gotten an NIN, the 11 unique numbers. What are the issues? The issues were created, the challenges was created because of the fact that the names were probably misspelled and they can't get all of those things. Then during the course of my investigation, I went to a lot of enrollment centers and found out that some of these buildings, facilities that are actually where these registrations take place, they are not disability friendly. People with disabilities cannot access them. And I appreciate previous speakers who spoke in the previous sessions. They actually hammered on these particular things. These are some of the things I actually found out on the field. And I brought all of them together to report about them to actually help create an advocacy for them. And because there are lots of disabilities and there are lots of needs that actually should focus on them.
African China reporting came up, I saw that gap that I need to look into how patients' rights have been protected digitally and offline. So I went into it. I started with excitement, setting out to administer about 500 questionnaires to patients because it's an hospital-based interview. So I started with lassos, hoping to administer questionnaires to 500 patients, but I was turned back because by the time I set out to do it, to see how patients' rights have been really upheld, I saw that the opposition of public hospital officials to interrogation, to investigation was alarming.